Babies are very delicate, and their digestive systems are still developing. It is common for babies to face some digestive problems during their early months. Here are some common digestive problems that babies might face. Colic causes babies to cry a lot for hours without any clear reason. It happens because their stomach is uncomfortable or gassy. Usually, it improves after 3 to 4 months. Comforting techniques like rocking or gentle tummy rubs may help soothe the baby. Diarrhea means the baby has watery or loose stools more than usual. It can cause dehydration, so giving enough fluids is important. If it lasts long, see a doctor. Keeping the baby hydrated with small, frequent feeds is essential. Reflux happens when stomach acid flows back into the food pipe, causing spit up or discomfort. Babies may vomit or seem fussy after feeding. Most babies outgrow it by 12 months. Feeding smaller amounts more frequently can reduce reflux symptoms. Gas causes the baby's tummy to feel full or bloated, making them uncomfortable and fussy. It happens when air gets trapped in the stomach or intestines. Gentle burping can help relieve gas. Using a calm feeding environment can also reduce swallowed air. You can also use belly wrap that soothes gas, colic, and tummy pain. It uses a warm herbal pouch with no chemicals. Simply heat the pouch and wrap it around the baby's belly. The warmth and gentle pressure help calm fussiness. Spitting up is common when babies bring up a small amount of milk after feeding. It is usually normal and happens because their stomach muscles are weak. It gets better as they grow. Keeping the baby upright after feeding can help reduce spitting up. Some babies cannot digest lactose, a sugar found in milk. This causes diarrhea, gas, or bloating after feeding. Special lactose-free formula or breast milk adjustments may be needed. Lactose intolerance symptoms often improve as the digestive system matures. A milk allergy happens when the baby's immune system reacts to proteins in milk. It can cause vomiting, diarrhea, or rash. A doctor can help find the right feeding plan. Avoiding all milk products is usually necessary until the allergy resolves. Thrush is a fungal infection inside the baby's mouth, causing white patches on the tongue or cheeks. It can make feeding uncomfortable. Doctors can treat it with medication. Maintaining good oral hygiene helps prevent thrush from recurring. Jaundice makes a baby's skin and eyes look yellow due to excess bilirubin. It happens when the liver is not mature enough to clear waste. Mild jaundice usually goes away in 2 weeks. Sunlight exposure in small amounts can help reduce bilirubin levels. Babies can have tummy aches from gas, indigestion, or mild infections. They may cry or pull their legs up. Gentle massage can soothe the pain. Ensuring regular feeding and burping can prevent tummy aches. Some babies react to certain foods, causing diarrhea, rash, or fussiness. Identifying and avoiding these foods can help ease symptoms. A doctor or dietitian can assist with identifying triggers. Sometimes, a baby's intestines can get blocked, causing swelling and pain. This is serious and needs immediate medical attention. Symptoms include vomiting, bloating, and inability to pass stool or gas. A hernia happens when part of the intestine pushes through a weak spot in the belly. It appears as a bulge and may need surgery. Hernias can sometimes become painful and require urgent care. If a baby cannot digest food properly, they may not gain weight or grow well. This condition is called failure to thrive and needs medical evaluation. Early diagnosis and treatment are key for healthy development. Hiccups happen when the diaphragm spasms. They are normal and harmless in babies. They usually stop on their own without treatment. Feeding the baby slowly may help reduce hiccups. Some formulas can make babies constipated. Changing the formula under doctor's advice can help improve digestion. Always consult a pediatrician before switching formulas. Probiotic drops help with your infant and baby's digestion and ease gas, colic, and constipation while supporting a healthy gut. BioGaia probiotic drops promote a healthy gut by restoring good bacteria in your baby's and infant digestive system. They help reduce colic, gas, and spit-ups, providing relief for common tummy troubles. They works quickly and give comfort to your baby. Knowing these common problems can help parents feel more confident in caring for their baby's tummy health. Early recognition and proper care can prevent minor problem from becoming serious.